Thank you for joining us for today's E-Referrals to the Sydney Local Health District Healthlink.
And good afternoon, everyone. Just before I kind of start giving you some background of, I suppose, Sydney Local Health District's journey in GP electronic referral, I thought I'd just cover off some of the learning objectives that we have today. So number one, that's to understand how e-referrals are generated within your practice software for those that haven't used that function yet. The second one is to understand that e-referral workflow within the general practice and touching on what happens at Sydney LHD to some extent. And then the third objective is to know which services are currently accessible and which we are building and expanding upon at Sydney Local Health District, plus some of the other e-referral centres or facilities that are accepting locally. Again, some of them you may have already used. I will also touch on then supports processes for using electronic referral. So as way of background, as we've been rolling out health pathways across Sydney LHD for a number of years, and part of that process is to have collaborative work groups with groups of specialists and general practitioners. One of the key themes that came out of those work groups was the need to move away from fax referrals. So back in 2017, Sydney Local Health District, in collaboration with the Central and Eastern Sydney Private Health Network, began exploring a number of options. And to provide some support to South Eastern Sydney Local Health District, who were looking at e-referral, we started working with a number of vendors and combination of vendors. One of the things we quickly picked up is that to have a successful e-referral program locally, it needed to be, I suppose, fairly simple to use, easily accessible to general practice, and with a format that GPs were already familiar with to some extent. And so on all of those conditions and basis and a number of lengthy trials, Sydney Local Health District has settled on Healthlink SmartForms as its tool of choice for using electronic referral. A lot of GPs already use Healthlink functions for secure messaging to facilities and certainly into private practice and VMO rooms, etc., as well as using it in increasing numbers to the Chris O'Brien Lifehouse, roads and maritime services for driver vehicle assessments, and since the middle of last year to my aged care as well. So it was an obvious choice for us to use a tool that was growing in use across general practice. So the other benefits for that is the fact that the forms are integrated within the practice softwares of Medical Director, Genie and Best Practice, and allow for an auto-populate function. So it meant that referrals could be conducted quicker, a lot more accurately, and with that ability then to pull resources from within your EMR, such as pathology, radiology results, care plans, etc. So with all of that functionality there, the end result is that we will get a more complete referral arriving at the hospital end. The other aim was to ensure that we had a system that would allow for some two-way communication and acknowledgement of receipt of that referral, as well as acknowledgement of the triage process. Next slide, thank you, Bertha. So currently we have a number of services that are receiving electronic referral. So as you can see from the slide in front, we've got some predominantly services at Concord Hospital. We spent most of 2020 rolling out electronic referral processes there to all of the major medical surgical services. And there is still ongoing work to bring a few other services on there, such as plastics, burns, etc., and pen services. So, I mean, as we've been rolling that out, we've also brought on a number of services at Prince Alfred Hospital. The majority of the services use a fairly generic template, and Sarah will show you a demonstration of that shortly, and which in the main auto-populate from the software and just allows you then to kind of put in your responses or your requests using free text functionality. We do, however, have the capability of building more bespoke and smart forms, and such as the ones for rheumatology, bone marrow, mineral density scanning, and direct access colonoscopy requests. So as I mentioned, 2021 will be bringing on predominantly services at Royal Prince Alfred Hospital, with the aim that by September of this year, the lion's share of medical surgical services at Royal Prince Alfred will be accessible by E-Referral, as you can see from that list there, as well as bringing on a number of community services and services at Canterbury and Balmain with that process. So this is an ongoing endeavour, and so we anticipate that all of the ambulatory outpatient services at Royal Prince Alfred or Sydney Local Health District should be connected to an electronic referral process around about mid-2023 as timelines go. One of the ones on there, the standout one, will be maternity services. That would be at RPA Canterbury, and the new midwifery group practice at Concord. So we're anticipating that they'll be up by the end of winter this year. It will certainly make a big difference in how referrals and bookings are made to that service. Okay, thank you. So I'm going to hand over to Sarah now to walk you through how that process works. Sarah.
Thank you, Paul, and hello everyone. So the demonstration today will focus on how to access the Healthlink SmartForms from within your practice software, how to complete a referral, and also how you obtain any feedback from the service following triage. So next slide, please, Bertha. So for all the main GP software systems, Healthlink SmartForms are integrated into your practice software. So what it enables you to do is, without having to leave your software, you can access all the available Healthlink services. So for best practice users, if there's any online today, you can access Healthlink by selecting the letter, so the piece of paper indicated by number 1, and then selecting the Healthlink icon from within the word processor. A separate window will then appear, which will have any previously submitted Healthlink electronic referrals here. And then you once again select piece of paper, and that will take you to the Healthlink service list. So next slide, please. For Genie users, from within the patient's file, you select Tools and Healthlink Online. A similar window will also appear similar to best practice, which will provide you a list of all the services you've previously referred to, and then the option to refer. Next slide, please. And for Medical Director, Healthlink is accessible via one of the tabs within the patient file, and then you select New Form and the service list will appear as well. So on the next slide is the entry point for My Healthlink portal for any users who do not have a integrated GP practice software system as well. The next slide indicates the dashboard that appears once you open Healthlink and all the available services that you can refer to locally. So for Sydney Local Health District services, these are available to the Central and Eastern Sydney Primary Health Network. There are also some other forms that you can access locally, including My Aged Care referrals, Chris O'Brien Lifehouse, and the Roads and Maritime Driver Assessment. So what I'm going to do now is I'm going to demonstrate how to send a referral to Sydney Local Health District. So I'm just going to share my screen and the demonstration will be from Medical Director today. So once you select New Form or you open the Healthlink window, you can then select Sydney Local Health District. So as Paul mentioned, we had a large number of services go live last year, in particular at Concord, and you'll see now quite an extensive list of services appear on the left-hand side of the page. What you can do is just select a service you wish to refer to here, or alternatively, you can use the search function at the top of the page and look for the service that way. Anything with a plus next to it indicates that there are other forms associated with that service. So gastroenterology is a great example, and these are grouped under these particular headers. So what I'll be doing today is demonstrating the gastroenterology form for RPA. So once you select the service, you select the corresponding facility and click continue. what will then appear is the Healthlink referral. So if you have used Healthlink before, you may see some similarities between other organisations' forms, but typically the Healthlink form structure is made up of the 6 tabs you'll see on the left-hand side of the screen. And request information is the page where all the SLHD service unique bits of information will be listed. So as we make our way down through the tabs, any mandatory fields will start to get completed. So you can select a provider to refer to from a drop-down list, indicate the referral period. If the patient does require an interpreter, if you do select yes, and the preferred language is available in your practice software, it will then appear here. You can also indicate if there's a compensable status that's relevant for the referral. And we also have an urgent field. So this field requires you to contact, in this instance, the on-call clinician, and then just to list who you discuss the referral with, the date, time and outcome. What this will do is also prompt the receiving service to retrieve the referral from our referral management dashboard. So this particular form we're looking at now is our standardised template, and you'll see this used across all of our services. Some services may have a drop-down reason for referral, but majority at the moment do have a free text. So what you can do is type your reason for referral. Alternatively, you can also browse your consultation notes and import a particular consultation note that may contain your reason for referral. You can also add to this at any point in time as well. As you make your way down, there's a field for other notes, which is non-mandatory, and then some specific fields regarding consideration for telehealth consultation. And if you believe your patient is suitable, you can select yes. If you do have a patient that has special needs or reasonable adjustments for disability, by selecting yes, it will give you the opportunity to provide further information. And also the same if the patient has a carer or support person, you can include 1 or 2 carers' details listed here, and also indicate if they're the primary point of contact for the patient. With everything and all of our forms, we always link back to health pathways. So if there's no specific requirements listed on the form, or you do want to check the specific pathway, you can click here and that will take you to the Sydney pathways. And finally on this page, we have the measurement details. So this will auto-populate from your clinical software. If there is a blank field and it's something you would like to include, you can manually enter the information here and that will update the table. However, this is not a mandatory table. So moving on to the next area is the attachments and reports. So the Healthlink SmartForm template supports lots of different file types in addition to the referral. So what you can do is attach pathology results, care plans, etc. The table we're looking at now will give you a snapshot of documents that you have available in your practice software. So you can select any that are displayed here. If you are looking for a file that's not in the table, by clicking Browse for Patient Document, you can then enter a specific date range, and then click search and look for a particular file. Alternatively, if you don't have the file stored in your practice software, you can browse for local file, which will interrogate your computer. If you do wish to preview any file that you have attached, you can select this computer icon and that will give you a preview. But merely by having the document selected here on the left-hand side of the screen indicates that the file has been attached to the referral, and a preview is also provided in the table here. So for medications and warnings, this is, I guess from this tab onwards is where all the auto population will start occurring from your practice software. So for any long-term medications that are not relevant for the referral, you can simply delete. Alternatively, if they're not in your software, you can also add a row and provide the details here manually. The same goes for other medications. You can also browse your software as well, see if there's any listed there. And for medical warnings, you can select if there's anything relevant that needs to go with the referral. So for medical history, slightly different to medications, this is where you can individually select what is relevant for the referral. If all of these long-term classifications are relevant, you can use the icon at the top here and select them all. Alternatively, you can just individually click and that will attach them. So for patient information, hopefully this is a tab you will not have to put any information in, as it will auto-populate from your practice software. For the referral to be sent, however, it does require a Medicare or DVA number to be listed. However, if the patient is an overseas visitor or is not eligible, you can select no, and then just to provide a reason. So referrals will not be not transmitted if this isn't completed. But all the patient demographics will come across from your practice software, which in particular is really helpful on the service side to contacting the patient to book appointments. The same with referrer information. This is where your provider details will be included, also along with your name and your practice details. We do populate the HPI and HPIO for electronic signature purposes, and your provider number here is obviously used on the service side to book your patient in for an appointment. On the last tab, there is an opportunity here for you to select another hospital. So if you've started a referral to Royal Prince Alfred Gastroenterology and realised in actual fact you wanted it to go to Concord, you can select Concord. But you will need to head back to the first tab, request information, and select a provider for the referral to be sent to. So once you're finished with the referral and you're ready to submit, you'd click the submit button. Alternatively, if you're not ready, you can park the referral and resubmit later. There's also a preview function that you can use. So once you click submit, if you have missed any mandatory fields, the form will prompt you to go and complete them. But what you should receive is a system acknowledgement on the top left-hand side of the screen, indicating that the referral has been sent and acknowledged. So what that means is that gastroenterology at Royal Prince Alfred Hospital has now received your referral into our referral management system. So the process, what occurs after you do submit the referral, I'll cover off how that looks in your practice software in a second, but from Sydney Local Health District's perspective, the referral is received into a referral management system. It would go through the normal triage process, and what we're able to do on our side is to send you back status updates. So typically you'll see accepted or non-accepted status updates coming back into your practice software, with some commentary regarding the patient's appointment date and time as well. We can also send requests for further information back to you. So you may receive a message saying, you know, please include additional pathology results. At the moment, there isn't a process for you to amend the referral that had been sent. So what you'll need to do is just resend another referral, and just to indicate in the reason for referral that it's in response to a request for further information from the service. So for the location of these status updates and also some other information where you get a copy of the referral, they're categorised here depending on what practice software you use, but you should receive the status updates within your practice inbox, and also a copy of the E-Referral will be stored within the patient's file. For medical director users, you actually get a Healthlink form was submitted as part of your consultation notes as well. So you may see that next.
So in terms of support, there are several levels of support, and it kind of depends on what the area of need is. If it's assistance with just establishing and ensuring that you are connected to the Healthlink system via your practice software, then we would advocate getting in touch with the PHN digital health team to make sure that you are running the appropriate level of practice software to handle the Healthlink system. So as you can see, you're all very familiar with Alex and Yvonne and Arturo and the team at the PHN for support of that. In terms of the functionality of Healthlink itself, Healthlink ran a practically an all-day advice line and helpline for general practice, and they can be contacted, and those details are also available on their websites about touching base. And again, a lot of that will just be about whether you get error messages in the transmission of referrals or your software's connectivity to the system. For questions then about problems with or issues with the form itself and again, that overall transmission, myself and Sarah, our numbers are on there, plus our email address. We're available to be contacted on Monday to Friday, 8 to 6 basis. And so information is also available via the PHN's digital health website. There's an extensive
Referrals available to practices outside of the Sydney Local Health District boundaries. For example, Sydney CBD or eastern suburbs.
And the answer is yes. So at the moment, our setup is configured by the PHN boundary. So that does go over the Sydney LHD boundaries. But we appreciate that you would be seeing patients that may live within Sydney LHD and they choose to see you outside of the boundary. So the GP's geography doesn't matter. It's the patient geography. We also appreciate that we have tertiary services that are accessible via this, and where it's appropriate that they are referred to, say, RPA or to Concord. So the short answer is you are open to it. There are certain services where they may turn around and say, no, you need to find a local provider, etc. But we've not come across that, and I think it's because we are so close together to Southeastern Sydney LHD, and we know that patients move and patients have a preference as well. So there's no barriers. If you can access these forms, then you are welcome to put those referrals in, and then they'll be triaged through that standard process.
Extensively as part of the antenatal shared care project. Will antenatal shared care referrals be available, and to which hospitals?
They most certainly will. So we're doing a project at the moment with eHealth New South Wales. From a general practitioner perspective, it'll still be using Healthlink. There'll be a different process at the receiving end. And as many of you know, if you regularly refer to either Canterbury maternity and RPA maternity, whether that's GP shared care, midwifery, group practice, etc., or direct to specialists, they'll all be available to refer to electronically. And as many of you know, it's a bit of a two-fold process where you not only make that medical referral, there is the booking process. And we are aiming to condense both of those processes into the one, where the referral will be the trigger to start booking first appointment. And so that will take the pressure off you as a general practitioner of having to go on and book that form, or getting the mother to be to complete that form. And that's all part of a bigger digital patient journey project that we're doing that will allow for better communication with the mother-to-be as well, in terms of relaying information back to their email addresses, smartphones, etc. So we're doing a lot of work in that space. So we're anticipating around about late August that maternity at Concord for group practice, all of RPA maternity and all of Canterbury maternity and gynecology at Canterbury and RPA will be accessible this way. So there'll be a lot more work done. The forms are in build at the moment, and we're not far off the stage of going to the antenatal shared care committee that's across the district and the primary health network to get form agreement of how those forms are going to work.
Thank you, Paul. And I have the last question, which arrived by email prior to the webinar, and that is, my practice uses a software which is not supported. Still refer to the Sydney Local Health District.
Sarah?
Yes, so you certainly can. So there are supported and I guess preferred GP software versions for Healthlink SmartForms for Medical Director, Best Practice and Genie. However, if you do not have one of those practice software systems, you can use the My Healthlink portal, which is online. So what you can do is you can visit the Healthlink website, and there's a simple process to create an account. The Healthlink web portal is actually now quite dynamic. You can assign referrals, receive status messages back from services, much the same as the functionality that exists for best practice Medical Director and Genie users. So most definitely you can.
I think the one thing it doesn't do is auto-populate to the degree that Medical Director best practice would do. We are receiving referrals already through that portal from opticians into our ophthalmology services, and they're obviously reporting kind of, I suppose, success with doing that. And I've lost my word, but they're certainly finding that an easy way to make those referrals.
To our speakers, and thank you to everyone for attending. Do not hesitate to contact us for any assistance with electronic referral to Sydney Local Health District.